discussion on preventing future pandemics, and we all want to hear the perceptions from the young One Health professional. Before we move forward with our original agenda of the panel discussion, I would like to request Dr. Apurva Pandya to give some highlights on the Global Public Health Week with WFPHA. Dr. Apurva Pandya is our director of Pariv Institute of Public Health, and he is working in the public health area since last 15 years. And he also attempts to understand the psychosocial determinants of health, gender, sexuality, and the impact of technology on the health outcomes for the marginalized population. He also received many fellowships, such as Fulbright doctoral fellowships and the fellowship from the University Grant Commission Research Fellowship in Science for matrix students and many others. So over to you, sir. Thank you so much.
Yes, thank you very much, Krupali. And hello, everyone. I hope am I audible? Yes, thank you.
Yes,
so
you are audible.
Yes. So I welcome once again all of you, particularly Dr. Abby, who is going to chair the panel discussion, and all young scholars who are going to be panelists, or faculty members and participants from different parts of the country. I would like to talk about the collaboration with World Federation of Public Health Association and the Global Health Week, and a little about Parul Institute of Public Health. So Parul Institute of Public Health is a constituent of Parul University, which is established in 2016. So we are very young, and it is a focal point for multidisciplinary education, research, training, and advocacy on public health, which is gaining prominence in recent times. Parul Institute of Public Health is a well-established network with public, private, and governmental institutions, both at a national and international scale and level. And we offer multidisciplinary programs such as Bachelor of Science in Public Health, Master of Public Health, Master of Hospital Administration, and Doctor of Philosophy in Public Health. And we are also planning to launch certificate and executive programs for working professionals in health and allied health professionals to contribute in the field of global health and public health as such. World Federation of Public Health Association is one of the oldest foundation, which is founded in 1967, located at Institute of Global Health, University of Geneva, Switzerland, and it represents over 5 million public health professionals worldwide. And the World Federation of Public Health Association has initiated celebration of Global Health Week from 3rd April to 8th of April. And today is the last day of Global Health Week, and we are proud collaborator with Global World Federation of Public Health Association to celebrate Global Health Week as organizing a panel discussion on the future of pandemic. And since today's topic is very much relevant to the Global Health Week, we thought that to collaborate with all young scientists across the globe, come together and talk about how One Health as a potential discipline to contribute not only in the regional public health, but contribute at a global level in terms of advocacy, in terms of programming, and in terms of implementing strategies at a local level. So with this idea, we initiated a collaboration with Global Health Week. And I would like to stop here and hand over the panel discussion to Krupali Patel, who is moderating this session. So once again, welcome to all of you to this wonderful panel discussion.
Thank you, Dr. Apurva. We also want to hear from Dr. Gitika Madan a few inaugural session word. So Dr. Gitika is our proficient doctor and providing services as a medical director to the Pariv University. She is working extensively on healthcare and administration departments. She is also developing very much initiatives and innovative techniques for effective administrations. Also in field of academia, she is highly driven in research and extensively pursuing the search for new and novel solutions to enhance the scope of knowledge while raising the humanity standards of living. She has numerous awards and accolades to her name for her outstanding contribution in healthcare, women empowerment, and for her work on COVID-19 and thalassemia as well. Over to you, Dr. Gitika.
Thank you, Krupali. A very good morning to all. First of all, let me congratulate the team of Parallel Institute of Public Health, Dr. Apurva and his team for collaborating in this Global Health Week. It's a wonderful concept. And I would like to welcome all those who have been participating in this particular week in any form to virtually to Parallel University. And I'm really glad to see that young people have come together and introspecting and defining solutions to these complex problems which have been coming to us in the past few decades. Very correctly said by Dr. Apurva that this year's theme of the World Health Day being Our Planet, Our Health. So basically, I personally feel that a high time has come now that we all start realizing that the pandemics are just not the disease pandemics or the medical pandemics, but we all need to understand and relate it to our own responsibility and accountability towards a better and a healthier planet ahead. And I feel that young professionals, institutions, professional bodies have a very important and key role to play to see to it that we have a better survival for not only for ourselves, but also for our coming generations. So the concept of Global Health Week, I really appreciate it being taken up by the young health professionals. I would like to thank all the panelists from all across the world who are participating in this. And I'm sure it's going to be very productive for all those who are attending this today. So the movement of global health has been emphasizing on the importance of One Health also, which includes emphasizing on the
Let's wait for a minute.
Yes, I think there is some technical issue.
just a call came and it got disconnected. So yeah, the movement of health is emphasizing the importance of One Health and climate change, along with food safety, humanitarian health, and multiple others. So this basically, I feel we are going to the grassroots of the things and the problems which have been causing these pandemics altogether. And the panel discussion is again focusing upon what is the perception of the young health professionals into this. So I'm very sure that the audience is going to have great takeaways out of this. And it's really important that we as young health professionals, we take over the task of taking this responsibility of betterment of the planet as a whole. And I'm sure the improvements would come with the kind of awareness and initiatives that are being taken over by institutions, individuals, and several professional bodies into this particular domain. So once again, I will congratulate everybody who has been participating today in this particular webinar and the panel discussion. And I wish all the best to the entire team for today's session. Thank you.
Thank you so much, ma'am. Before we move forward to our panel discussion, I would like to introduce all of our panelists first, and then we will move forward with Dr. Abhi's the opening speech. So, Ms. Anna Maria She is the coordinator of NRW One Health and Urban Transformation Graduation School of Bonn University since 2021. She is also a doctoral student, and her thesis covers the topic related to One Health governance and social environmental determinants of health in Agra. She is further associated with the International Center for the Sustainable Development within the framework of Project Energy for healthcare facilities in Ghana. So she has also actively worked in Ghana during her master's and also during her doctoral time. Before starting her doctoral studies, she also worked for the public-private partnership on climate risk transfer and agriculture insurance. She has also worked with the cooperation for German cooperation for the international cooperation and Swiss Re for the Agriculture Unit and United Nations Economic Commission for Latin America and the Caribbean. She holds the Master in International Agribusiness and Rural Development Economics from the University of Göttingen in Germany. And she has also achieved her Bachelor in International Businesses from the University of Guadalajara in Mexico. So she is basically from Mexico and moved to the Germany for betterment of education, and then she is now a young leader in the health economics, health policy, and health system. So moving forward to Dr. Danis. Dr. Danis is postdoctoral researcher at Institute for Urban Public Health, Essen University Hospital in University of Duisburg-Essen in Germany. Dr. Danis holds a doctorate degree in geography from the University of focusing on interlinkages of environment and health, and particularly interested in aspect of water sanitation and hygiene with integration with the health approaches and complex health challenges. His doctoral study, which was very interested, he worked on antimicrobial resistance and wastewater system. He also investigated the socio-spatial hotspot in metropolitan area of Germany as a part of international graduate school hosted by the Center for Development Research. Apart from this, his academic work, and his consultancy work is also affiliated with WHO, European Center for Environment and Health, which he is coordinating the communication with the member states of WHO European region at the different global wash monitoring mechanism. So he's also involved in WHO, UNICEF, and the JMP ladders and the glass also. So moving forward to, I welcome Dr. Danis. Basically, we can say he is a geographer with expertise in health and environment. And now moving forward to Dr. Monal. So Dr. Monal, is a veterinarian and public health professional from India. Since the last 8 years, she has worked in multidisciplinary environments. So she comes from the veterinary aspect, but she has connected herself with the public health domain very effectively. She has also worked for Department of Animal Husbandry for National Animal Disease Control Program and breed development programs such as brucellosis, FMDCP and PPRCP in India. She has worked with healthcare professionals in National Center for Disease Control, Government of India. She was engaged in program development and implementing of National Public Health Program for rabies, leptospirosis, and zoonotic disease control. She was also a part of the COVID-19 response team in Delhi. For that, she has also appreciated by the Ministry of Health and Family Welfare of India. She was affiliated with the National Institute of Epidemiology in Chennai And she is currently right now working with a global health consultancy based in United Kingdom for local health programs in London. So Dr. Mona, I also welcome you for this panel discussion. Unfortunately, we do not have Dr. Kosi with us. I think he will join us lately. Let me quickly introduce Dr. Kosi. So Dr. Kosi Savi is a postdoctorate research at the at the Harvard University of School of Public Health at the Department of the Epidemiology. He conducted his doctoral degree research on application of system approach and mathematical modeling to assess the impact of spatially located communities' behavior on the effectiveness of insecticide-treated bed nets from malaria control in Ghana. So by first degree, he is a statistician and ecologist, which he extended his expertise in health domain. He also worked very effectively during COVID-19 with Benin government. He worked for 5 years prior to his PhD as an independent consultant in data engineering and data analysis. He also involved in numerical in the many resolution for the banning also. So he's working mainly on the modeling in terms of ethnography, linear model, toxicology, One Health, and infectious diseases. So I welcome all the panelists. I think we have the different domain panelists, which will make our event more fruitful. And finally, I would like to invite Dr. Abhi Vanat. He is the chair for these sessions. Dr. Abhi is the senior fellow at the Center for Biodiversity and Conservation at Pariv, Bangalore, DBT Wellcome Trust India Alliance fellow, and an honorary professor at the University of KwaZulu-Natal, South Africa. He is an ecologist by training, but he has expanded his interest in several fields such as animal movement ecology, disease ecology, understanding savanna ecosystem and their dynamics and human-wildlife relationship in such landscape. His interest in disease ecology led him to explore the dynamics of pathogen transmission between domestic animal and native wildlife using One Health approach, and he is the lead author of the One Health and Zoonosis program of the National Mission on Biodiversity and Human Well-being. So far, I know he is also actively involved in National Rabies Disease Control Program. So, welcome, Dr. Abhi, for chairing this session. Before we move forward to panel discussion, I would like to invite Dr. Ravi to give his opinion speech on what is his opinion on planetary health on this eve of World Health Day 2022.
Thank you, Pipali, and thank you to the organizers for inviting me to chair this. I'm really excited and looking forward to engaging with the scholars that we have on this panel. And more than anything else, I'm really excited to learn from their varied experience and their expertise. And I think this will be a really exciting 1 hour that we have. I don't want to take too much time talking about what I do, but very briefly, I will just introduce my area of research and how it I suppose barely qualifies me to be chairing this panel, but I'm a One Health researcher, a newly minted One Health researcher, looking at how zoonotic disease transfers, especially along the human domestic animal wildlife interface in a country like India, which has amongst the highest densities of human beings, a very saturated domestic animal and wildlife interface, and rapid landscape transformation across the board. And this sort of creates the right kinds of conditions for hotspots of emerging and re-emerging infectious diseases. We also have And India also has a growing middle class, which is aspirational. Therefore, our requirements, our energy needs are increasing, and people's aspirations and lifestyles are improving for especially in terms of their requirements for energy, for water. We are also urbanizing rapidly, and all of this comes at a cost of natural ecosystems. The watershed for our urban areas is increasing. So the catchment areas are going further and further into previously forested landscapes or natural ecosystems, creating changes that are undesirable to many of these landscapes, and creating conditions that as a public health specialist one needs to be wary of. We also have, I mean, we are still largely a rural landscape, and large parts of India have communities that live within forested landscapes and are dependent on forested landscapes for their daily livelihoods. And therefore, their interactions with these landscapes creates conditions that are ripe for the emergence or the possible emergence of new pathogens or the re-emergence of pathogens or the transfer of pathogens from one area to another that were previously in areas that were previously not seen. We also, as I mentioned, have a very large domestic animal population, and these act as conduits for diseases, zoonotic diseases, to emerge from the wildlife interface. Let's not forget that India is also a biodiversity hotspot, has and is one of the leading sort of areas of endemism in the world as well. So given all of these things, it's important to examine the risk of emergence of these pathogens in India especially, and in countries like India, across the global south, where people and animals interact very closely, to examine this from a One Health perspective, which involves not just the natural sciences, but also the social sciences. So understanding people's behavior is as important as understanding the pathosphere out there or the virusphere out there, because it's ultimately their daily use of these landscapes that creates the conditions for exposure and allows us to estimate risks. So you have the hazard and you have the exposure. So between those two parameters, we are then able to estimate risk of these diseases. We are also we're also looking at a country that's an emerging meat producing country. We are already exporting a lot of meat, but our biggest growing sector for meat consumption is domestic, and most of it comes from the poultry sector. And along with that comes AMR. We have a huge problem of AMR, so antimicrobial resistance, developing both in situ in the poultry farms, and the risk of environmental contamination of AMR is increasing. A study that we are doing in a rapidly changing watershed in Maharashtra shows that there are gaps, and I'll discuss this further when we're listening to Dennis talk about his work. But there are gaps in the surveillance mechanisms that are out there for environmental contamination for AMR. And so these are sort of areas of concern, and basically allows me to now segue into what Kripali was talking about, the planetary health boundaries that the Planetary Health Alliance group has come out for. So what are these planetary health boundaries, and what is the concept behind it? So basically, several institutions got together and came up with these 9 planetary boundaries, and they consist of measures that basically allow us to estimate how much of it we are utilizing, or are we moving in a direction that exceeds the capacity of the planet to absorb or recover from these changes that we are making to the landscape. So for example, we have the stratospheric ozone depletion boundary, the loss of biosphere integrity, which involves biodiversity loss and extinctions, chemical pollution and the release of novel entities, such as synthetic organic pollutants and several others. Climate change, of course, this is going to be the existential crisis of our time, and I'm hoping to discuss this a little further during our panel discussion. Ocean acidification, freshwater consumption, and the global hydrological cycle, and the impacts that all of these others are going to also have on this. Land system change, nitrogen and phosphorus flows to the biospheric oceans, and as atmospheric aerosol loading. So these are the 9 planetary boundaries. And every year, almost all of these are being exceeded. So we are in some cases, for example, nitrogen, phosphorus are exceeding our limits several times over. Biodiversity loss, we're already in the Anthropocene, we're facing an unprecedented biodiversity crisis. So with this not very pleasant picture, I'm now going to turn over to the panelists and have them introduce themselves and their work with a brief opening remarks from each of them, and then we'll get into a question and answer session and explore what we can do to sort of very ambitiously talk about preventing the next pandemic. So I'll start with Anna Maria, if you don't mind. Please, why don't you tell us about your work?
Thank you, Chair, and I'm very happy to be here. Thanks, Krupali, for organizing this event. I'm coming today with 2 hats. On the one side, I'm the coordinator of the graduate school One Health and Urban Transformation, hosted at the Center for Development Research of the University of Bonn. And on the other side, I'm also representing my own work and research. So at the graduate school, that is the first thing that I'm going to introduce. We work in a transdisciplinary way. That means that we are really looking for practical application of the research that we do. And we are under the One Health umbrella trying to tackle complex problems of the 21st century, particularly looking at cities. We work in Ahmedabad in India, in Accra in Ghana, Sao Paulo in Brazil, and the Ruhr metropolis in Germany. So working with transdisciplinarity is quite complicated because we have to find practical partners. We have to find practical applications, and for the sake of the traditional way of doing research, that is a bit of a challenge. So we started in 2017 with 13 doctoral students that were grouped more or less under 3 thematic areas that were looking at food systems, One Health governance, and health in urban green and blue areas. Then in 2021, we welcomed the second phase of our program with renewed 13 doctoral students. And we learned that we had to expand a bit the 3 thematic areas, also related to the developments that the pandemic brought to the One Health approach. So we kept food systems, governance of One Health, but we took more strongly into the implementation of the One Health approach. Then we had it before antimicrobial resistance, but we had to make it more present, and finally the surveillance of using the One Health approach. Why do we work in cities? Because health inequalities in cities are very present, and also the development of these cities are creating pandemic ecosystems in which the humans have close interactions because of these same movements of the city development. And that was as far as I can say in like 2 minutes of an overview of what we do at the graduate school. So now off to the work that I do. I focus on One Health governance, and also how different kinds of institutions are shaping this One Health, how the effects of the physical environment on health can be mediated by different institutions, either formal or informal. And by informal, I mean by the social network and the social environment of each of the individuals. And on the more formal level, how the One Health policies and the One Health governance is can actually come out to the policies and be implemented. So that is as far as I can say from myself. Thank you very much.
Thank you so much, Ana Maria. I will request next Dr. Kwasi Savi. Am I pronouncing your name correctly? Please forgive me if I'm not. Right. Go ahead.
Yes, indeed. My name is Kwasi Savi, and over the past year, I worked on the One Health Graduate School as a junior researcher, where I focus mainly on malaria. But in between, the COVID pandemic happened, so we similarly work on COVID, and particularly I work in the context of Africa, where in the very onset of the disease, a lot of measures have been put in place by African countries. I mean, not following necessarily what is going on outside, I mean, in European country. For instance, to be very specific, in Benin, there is no like a strict lockdown that's happened, but it was more about creating some corridor where people can still, the movement is restricted and still not like really strict lockdown. There are some area where people can freely move. And recently I joined the Harvard team, which is called a project which is called Crisis Ready. And mainly we are kind of addressing this hot question, which will be, how can we get ready for the next epidemic? And in that regard, we are mainly using big data and artificial intelligence to predict and tackle all the crises that are happening. And one of the key aspect of it we are using now is the mobility data. Why mobility data? Because out there we have a lot of social media, and even when you are using Google, for instance, not knowing you are displaying your position. So those, what can we do to better the preparedness of country using this kind of mobility data? Is it possible to predict and to foresee an upcoming epidemic? And in a nutshell, when this whole thing of COVID have started, we thought, I mean, the whole world was expecting that it will not spread quickly, but because of the mobility of people, it quickly spread. So this is one of the key thematic we are addressing, and is all I can say for now. Thank you.
Excellent. Thank you so much. Next, I'll bring in Dr. Monal to talk to us about her work in India and elsewhere. Thank you.
Hello, everyone. So I am Monal, and I have recently switched from the government sector to a private sector. But I have been working with medical doctors and veterinarians at the national level as well as the field level. So they think very differently. People who sit at the national level, they have very different point of view of how things work, and people who are the veterinarians, the veterinarians who are at the field level, they are at a completely different wavelength on what should be happening. So that's one thing I have noticed in almost last 8 years. And what I am planning to do right now is, I'm having my own projects, and currently I'm working on something called as developing a tool for, climate sensitive tool for digital surveillance of animal diseases and human diseases, and planning to draft a project for that. And extensively involved in rabies control program as well. And I have come across Dr. Abhi's papers, so I know he has been working a lot on rabies, so I know what he has been up to. And yeah, one more thing we should start thinking about is, okay, fine, we know that there are 70% of diseases which are occurring in animals, in livestock. Okay, fine, we know that. Now what? What's the next thing? What are the interventions which we can work on? So that is something which I would really like to work on as well, because I mean, the government policies, what we are doing at the field, and what we are talking are three different things which are happening right now. So that's one agenda on my mind. So that's it from me.
Thank you, Monal. We'll come back to you further with some of these field experiences of yours. Thanks. And lastly, definitely not least, Dr. Danish, and I hope I pronounced your last name properly, Dr. Danish Schmule. Is that right?
Yeah, that was actually perfect. Thank you very much, Dr. Avi, and good morning, everyone. And thank you very much, Krupali, for organizing this event and for the Pariv Institute for Urban Public Health for inviting me. Yeah, my name is Dennis, and I would like to draw on my experiences also previous as researcher, being part of the graduate school as indicated by Krupali, but also in my current position as a research associate in the Institute for Urban Public Health. At the onset of the COVID-19 pandemic, we were all struck by not being able to conduct our field research really. So we decided to use our time efficiently and came together as a small working group within the graduate school to conduct a review, a systematic review on the how One Health concept has been used so far in the context of coronaviruses, which then included back then SARS-CoV-2, obviously, but also SARS and MERS. And I think one of the main findings there was definitely that the environmental dimension was still neglected. I have to say, as a disclaimer, that this work happened in 2020, so we would definitely have to update this review now to be able to make the same claims for 2022. But back then it was kind of interesting to see that of all of studies that we identified, that although they claim to be the One Health or do One Health, they actually mainly focused on not all three domains. And that especially this human animal environment interface is obviously super important. And I think it's in order to, I don't want to say prevent the next pandemic, because I'm not sure whether we can really prevent the next pandemic, but I like what Kwesi said. He said, like, how can we get ready for the next pandemic? Because this implies that there will be a next one. And I actually share this opinion. I think it's really important to identify hotspots. Do we have to look into like the cocktail of different drivers, right? Like where do we have habitat encroachment due to deforestation or agricultural intensification paired with loss of biodiversity? And even what you said, Dr. Abi, I take as a very key concept, density of humans, density of animals, and maybe even those interactions then specifically that are interesting. Interesting from a research perspective, obviously. This was my first point I would like to raise. The second one is the work that we're doing right now at the Institute. We are involved in COVID-19 work as well, although very locally here in Germany, in the city where we are sitting in right now, which is the city of Essen. We analyze SARS-CoV-2 infection data, so PCR tests, at a very high spatial resolution. So usually when you look for data, I don't know, anywhere in the world and specifically in Germany, you find data at national level, at federal state level here in Germany, and at city level, but afterwards it usually stops. And we were always wondering about that because I think there are definitely hotspots at much higher spatial resolution that you could identify. And then, so we were interested, like for the city of Essen, like where those hotspots, where this SARS-CoV-2 infections mainly occur, and what was the influence of the built environment this time? Because, like I mentioned previously, especially the environmental domain is often somewhat neglected, at least. And a last point I would like to make here is bringing together aspects of my PhD and my current work as a research institute is we are involved or starting to get involved into wastewater surveillance. My PhD started this journey to a certain extent. I worked on, as Krupali mentioned, on antibiotic resistance. So we measured ESBL, so extended spectrum beta-lactamase, E. coli in community or untreated community wastewater to see whether there are differences between social spatial different communities, again, at a very high spatial resolution within one city. Because there, again, we have a lack of data. We have a lack of, especially lack of high spatial resolution, I would say. But what this work also shows, and the current pilot project where we actually measure SARS-CoV-2 RNA here in wastewater, it really shows that how interesting and fruitful, but at the same time, how challenging intersectional, interdisciplinary work can be. I personally, I enjoy it, but I also would like to acknowledge that there are, of course, like advantages and disadvantages to a certain extent. And it may actually take time to redevelop a common understanding, and not just that, but actually to let's say develop a common interest, because it doesn't lead anywhere if, like, let's say one or two out of a joint group of parties interested, but the other ones don't really get the point, for example. So those 3 points I would like to bring in today here, and I'm very happy to be here. And once again, thank you very much for the opportunity.
Dr. Ravi, you have
sorry, I'll unmute myself. Well, since I left you hanging for so long, maybe I'll start the first general question with you, and then I'll open it up to the rest of the panelists. It has to, of course, focus with what we're all still going through, the COVID-19 pandemic. We are not, despite our optimism, we may not be fully rid of it yet. But the question is, what are the lessons we're learning from this? And have we learned the right lessons from it? And I ask this in particular because we know that many countries, of course, have made lots of mistakes going forward, and it's not like we didn't know that a pandemic may emerge. In fact, we had several false starts. We were lucky a couple of times with SARS-1 and with MERS that they didn't become the kind of pandemic, the scale at which it could have. They would have been deadlier as well. But what's going on? I mean, why are we learning the right lessons here? And if not, in your opinion, what can we do better going forward?
Well, if I may, then I will just start.
Yes, please.
I think the COVID-19 pandemic showed us brutally honest how unprepared we actually are at the global scale. And this pertains to all the other levels that come, let's say, afterwards, especially at national scales, because I would totally agree that there's definitely a lot of things and measures and aspects that really did not go too well, let's say, in different stages here. I think on a positive note, personally, I was impressed by the rapid advancements in developing diagnostics and to a certain extent also therapeutics. This was very interesting to follow from a scientific perspective. On the other hand, also that there, and this goes basically as a kind of like disadvantage point, is that I think we definitely need next time more coordinated actions to a certain extent, especially in the beginning. Or now, let's say in the let's call it the midst of the pandemic, because I really think we're not at the end right now. You see a lot of like scattering or let's say approaches, efforts scattered across very different sectors and different institutions, different, I know, geographical settings, and I think we would all probably benefit from if this would be somewhat coordinated. And I don't say that there need to be one centralized, major player, but at least the different aspects of those are maybe decentralized, organized. But right now, like I said, we see a lot of scattering and fragmentation, which really, I would personally say, perhaps even hinders like further progress. This would be my take.
Excellent, thank you. Maybe I'll ask Anna Maria also to maybe talk from the governance perspective about preparedness a little bit. Would you be able to?
Yes. Yes, thank you. I think that this is a very interesting question that we all have at some point from the different work that we do at in our minds, and I think that something. We work with Dennis and Kosi and Krupal in that paper in 2020, looking at the different developments with the coronavirus infections before the current one. And something that really surprised me, looking outside of not only this current pandemic, but also diseases that happened before, other pandemics historically, is that there is always a movement of different domains and sectors that come across. First, we have like this biomedical domain that looks at diagnosis and therapeutics, and that is what Dennis said, like that was very quick. That is something that even in this COVID pandemic, the rate for the vaccine, that was something that was so interesting to see. But after the biomedic, after that infrastructure, after the knowledge has been developed, then it comes how that can actually reach people. How is the health system in place? How many people have access to hospitals? How is the infrastructure? How many medical personnel we have, and how which is the burden to them? And if we I was very interested in even looking at the cholera epidemics in Europe historically, even in the Middle Ages, that when there was research that was saying how this cholera was happening, the disease was described, then okay, well, now we know it is in the environment. We have to make the environment right for the people. But then also the behavior of the people is something else. And that is, I think, that for the COVID pandemic, something that is one of the bigger lessons learned, that even when we have the pandemic, even when we have the capacity for attention, the beliefs of the people are making the people either to get vaccinated or not, are making the people either to stop social contact or not. And sometimes there is a need of a very strong government that will give the direction to that. And the problem is that when there is a situation like the pandemic that we have, we need quick knowledge. We need to react quickly, particularly from the government side, but there is always a lag between the development of the knowledge and what can actually be applied. I don't know if the lessons learned were or are learned in the right way, because this is a pattern that comes over and over again. And I was talking about cholera, but we can look at also the institutional violence that happened with Ebola, how at the beginning it wanted to be contained and the government didn't want to take responsibility from it until it spread to economic powers, then the action was being taken. So looking to the future, I hope that we can say, looking back at this moment in time, that we learned the lessons right. But yeah, there were many other things that come to the forefront and were morely related to social inequalities.
Thank you. That's in fact, that allows me to segue into a slightly different question that I'm going to pose to the other two panelists now. One of, well, clearly there was a North-South divide and it continues to be, either in terms of vaccine availability and vaccine reach, but also, and this is something that sort of struck me, was that the divide seemed to almost disappear when it came to knowledge availability. Because I think everyone, it didn't matter whether you were in the global north or you were in the global south, the dynamics, the within community dynamics sort of mirrored themselves across all of these communities. So for example, vaccine hesitancy or mask mandates or the lack thereof, the availability of the right kinds of information going on, and of course, the rapid spread of fake news and the alt movements sort of disrupting the control of the pandemic played out. So here's a question to you, Kwasi, is, what do you see as one of the biggest challenges now, and perhaps an opportunity, when we talk about some of these inequalities and inequities in the distribution of both vaccines, as well as in the knowledge that was generated around the pandemic going forward, or even for applying to the current situation that's happening in, say, for example, in Africa, but it could be in any other continent also, it could also be in Asia.
Thank you very much. we have learned certainly a lot of lessons from this pandemic. But one of the biggest lessons we learned was that in terms of pandemic, we still need scientists to think about what is going on, give us an insight, and we equally need politicians to take decision and strong decision. And on the onset of this whole thing, we have noticed like there were two major group of country based on their reactivity. You have low reactive country versus high reactive country, which is not spatially spread. Because for instance, in the cluster of low reactive country, you can have US and UK, and they are characterized mainly by the denial, the delay in reaction and so on. Conversely to the other group, which reacted pretty fast. But when we are talking about the social inequality in terms of vaccine spread, this is highly challenging because, I mean, this whole pandemic portray not only the inequality at a continental level, but also at a country level. Why? Because people that were more strike in Africa were not necessarily people which were strike in Europe, for instance, because in Africa, it was mainly the poorest people that were struck by the pandemic because they can't afford staying at home. They can't afford, I mean, the personal protective equipment that were needed. And they were kind of exposed constantly to the virus. So there is a lot to do in terms of political decision, but what really worsened the whole picture was the fake news that were out there, because people all of a sudden everyone became epidemiologist and could advise about what is going on. Meanwhile, most of them, they don't have any clue of what they were saying. So I think that one of the biggest challenge would be the control of the information, maybe, which in terms of, I mean, in some of the domain, the very sensitive domain need to be really filtered. And or I don't know, maybe some of the government need to create a very reliable platform where uh, where citizens can access the correct information and make their decision based on that. Because again, the reluctances of people to get the vaccine also come from the widespread of fake news. The list of fake news, I mean, what fake news have done is really, really like, we can't really count it. So I think one of the biggest challenge for the next pandemic will be how to filter and create a reliable platform for people to get access to the most accurate information.
I agree with Dr. Kosik 100%. India had a similar reaction because what I felt in the whole during the pandemic is that there was a serious disconnect between science, what decisions were made, and what the people were actually doing. There was so much of information out there. Every person was an epidemiologist or a public health person. Every house has an epidemiologist and a public health person. Forget, you could just literally sit over there and listen to the theories people had and the amount of information which was out there. So I think we have to come up with something like infodemic management, a media handle or a tool or a place where only correct information is going out and filters out all the things which are going and gives negative values to all the wrong information which is being around in the media. We need to have a system like that. And even if we have a system like that, we can't actually stop people from spreading the news. There's actually no way we can control it. People are just going to talk about it. They are going to have their own analysis. I literally know every person who was an IT person or engineer was doing their own modeling just for the sake of it. You go to GitHub, you see the amount of people who are doing COVID-19 modeling. It is crazy, you know. So about the infodemic, nothing can be done. Second, about the vaccine inequality. Yeah. So I remember when in 2021, yeah. So when the vaccine was just launched in India, and we were specifically given the first, option to get the vaccine. We were at the frontline workers at that point of time. So I had a wait period of 4 months before I got my vaccine. I got my first vaccine, and while I was preparing for the second dose, I was a breakthrough infection. I got COVID, and many people got COVID before they got their vaccination done, and we were on the front line. So you're talking about people who are poor and children. Let's talk about the healthcare workers as well. We did not get the vaccines on time. However, you're going to expect people at the ground level going to get vaccines, right? So one thing is, the second thing we have learned from the pandemic is that. Third thing, the transparency of the data. I mean, if you look in India, and each state had a different COVID containment plan going on. It was actually decentralized in a way. Every province had a own COVID management program, and the data transparency was different. For example, I remember Maharashtra had a very good data transparency, and Kerala had a very good data transparency. And for Delhi, I was working for the state of Delhi, and it was madness because we could not get the data at all. And I was working with the government, and we could not get the data. That's the funny part. So it was a crazy time. So we should start talking about the amount of data which needs to be available on the public domain. And as we as a citizen have every right to know what is happening in the country, because it is going to affect you. So that's my take is maybe the next pandemic, we should think it is going to happen to us as well and start planning on that measure. This with COVID, we thought, okay, it's in China, it's not going to happen in India. तो बहुत दूर है, it's very far, but it did happen because SARS, CoV-1, again, we were saved by that. Ebola, we are being saved by that. So we had we are looking at the glass half full way of looking at things. But with COVID, they had the same vision, and then that's where where we were we were hit hard. So that's the fourth problem. And fifth problem, any pandemic, we are going to be hit very hard. The sheer amount of numbers is the sheer amount of people who are going to get infected. You will be having all the medicines, all the vaccines, everything will be on point, but we had too many people, too less of doctors. So that's the two problem which we need to address in the future.
Can I quickly chip in?
Yeah, sure.
No, just because I really like this. I was really interested in this discussion around the communication and the messaging, and specifically misinformation. I mean, I think the WHO even called it an infodemic in the end. I think at least building on the experience that we had here in Germany, building, for example, like a central platform where you can have all the information available sounds super interesting. But based on the experience that we made here, is you really need trust in those institutions that build those platforms, for example. Because like if you would ask me personally, we would have such a reliable platform. But I go outside and ask like any other Germans, for example, that have a very different opinion of those institutions, they would say, I don't trust that. I go to my, Telegram group or whatever you want to call it, because there I get the reliable information. I think this is just a word of caution that I think we do have some kind of like on paper we would have solutions, but I think making them work, and this also boils back or boils down or goes back to Dr. Abi said also in the beginning, is like it's human behavior again, and how do you ensure that the let's say the right information reaches the people? And I think the first difficult thing in a pandemic is to determine what is the right information. And I think this also then really needs transparent and clear communication, also on the decisions that you make, because I mean, you make those decisions as a politician or as a policymaker or decision maker under huge uncertainty in this sense. I mean, none of us experienced the pandemic so far. And this is maybe a slight positive take home message from the pandemic, maybe here in Germany, is like we got acquainted to wearing masks all of a sudden. This was non-existent before. Yes, there is of course a lot of hesitancy around it, and like we are basically letting go of all our measures here now. But I think if the next pandemic might actually occur again, people are somewhat prepared of what it actually means to go into a lockdown or to wear a mask in public places or so. So I think this is maybe something that, at least here in Germany, we have to say that we got acquainted to a certain extent as maybe somewhat of positive news, that some positive behavior change might actually have occurred. Thank you.
Yeah, thanks for those.
Here, sorry.
Yes, please go ahead.
For Avi.
Yeah,
Yes, I would also like to have my small contribution here, because I tend to disagree to what Kwasi said about the fake news. I tend to very strongly disagree, and that is basically from what Dennis mentioned, like reliable information. We are scientists. We know that the information that we see as reliable information today, tomorrow we might develop new statistical methods and have access to data that will just make the information or what we consider the truth today to be different tomorrow. And that is a toll that the scientifics we can take. We know that the knowledge change, but politicians, they cannot take that. And health is a very politicized topic. And I think that the fake news, it's beyond calling it just fake news, we have to see where that comes from. And it comes from hundreds of years of very unethical behaviors from institutions and even from scientists developing knowledge that have just been attacked the specific groups of the population, that the government has the opposition. And of course, like these thinkings will always develop, that there is a vaccination coming from the government, or there is a knowledge coming from institutions, or we have a specific group of scientists telling us that there is this disease, but we know from the history that they have been trying to, that we are in opposite sides. So I think that this is definitely like a social development that is based on very unethical practices along the history. And we can just not say like, well, we need reliable information, we have to limit the information, because in the policy side, they need very quick information available. Scientists, we know that it takes time, and we can prove in some months wrong what we today thought that it was true. So I think that is something that we can learn now, looking at also this development of where this opposition is coming from, what we call today fake news. Yeah.
Thank you. I think those are all amazing, excellent points, and I just want to add to that if going forward, how do you convince people? And if you think of the group, if you think of ultimately it comes down, there's so many things. There's politics. We know that politics play a huge part in misinformation and disinformation campaigns. Certainly it did in India, and it did in US and in many other countries. People have their own political compulsions for doing this or doing the other, depending on which side of the spectrum they were on. But I think one thing that maybe scientists need to also learn, because all of us here are on the scientific side, but is to engage with public health professionals and behavioral scientists, because ultimately it's about influencing behavior. And perhaps one trick that maybe most people missed is talking to advertising people, because that's what advertising people do. They know how to influence people's behavior. And maybe that's something that we can think about, and it's a double-edged sword, but it also comes to the point that Anna Maria was making about the uncertainty. Because we are learning as we go along, there was a lot of uncertainty associated with our decisions. So for example, the drugs that were advertised as being a treatment for COVID, or for reducing the symptoms, that kept getting updated, but that kind of information didn't always trickle down. So let me just take off on that last point that you made about the science policy disconnect, Anna Maria. And it comes from what you do as well in terms of the governance of One Health. One of the things that we've faced challenges with when trying to propose a One Health program is seeing how do you, all the different ministries and the different departments have schemes that work as silos when they all need to be talking I mean, that's sort of the fundamental concept of One Health, is that you need to be collaborating, intersectoral, transdisciplinary, interdisciplinary, all these nice words that we like to talk about, that the government likes to talk about as well. It's there in every government policy, intersectoral, etc., etc. How do you put it in practice is a completely different question, because they're not really designed for this. So if you had to suggest in an ideal world that if you had to do this from scratch, how would you go about thinking about putting this in practice? Maybe it's a tough question, but go ahead.
Yes, it is a tough question, and I might need some minutes to think about it, because I am working particularly on that direction in Ghana. There is for quite a number of years now, they have trying to put forward One Health policy for the country, and that is very difficult. It's very difficult to to bring everything on board and to have the same way of talking, the same way of communicating, and the way of understanding, because we come from different domains. I think that something also that in the graduate school we learn a lot is that now we are like a newer generation. We are trained to do multidisciplinary research and also with practical applications. But at some point we stand in the middle of nowhere. Like my supervisor comes from one research area, from one discipline, and she wants me to publish into that discipline. And of course, like I think that is something that really has to take time, that has to do a lot with the training and how scientists are being trained nowadays. And we will see the implication of that only in some years to come. I will think of a better answer to give you perhaps later, but for now, that is something that I can say. Maybe my colleagues can add on that.
So I'll open up this question more broadly to the panel and sort of throw a challenge out there. At least give me an example. Give me an example of something that you've seen work successfully. Anyone?
An example of a One Health collaboration you're asking?
Yes. Yeah, a One Health collaboration that's really got the government going between different sectors and has got NGOs, civil society, and people on the ground working together.
So I'm talking about India, and I'm talking at the policy level. So you might know very well, that recently that National Action Plan for Dog-Mediated Rabies Elimination was launched, and it took almost 3 years, and 3 years of discussions with the animal husbandry sector, veterinarians at the field level, at the national level, and at every level. Basically, if you want to start any One Health project in India, you have to understand and respect the other person's profession, their agendas, and what is the core value of the profession and what they are actually doing. You really need to have an understanding what the other person is about. I mean, as a wildlife specialist, I should understand what the way you think and what is the priority for you. That's the only way we can work, and we have to finally adjust our goals so that we all the three of us are happy. And that's what ultimately happened in the rabies plan. We had to ensure that the policy level people are happy, the veterinarians are happy, the medical professionals are happy, the scientists are happy. Okay, and okay, it might not be like 100% perfect example, but at least we have reached 60%, 70%, right? So that's one thing. So there are like small baby steps, and we definitely need to engage more people and engage a multidisciplinary people. And multidisciplinary it's just not medical doctors or veterinarians or wildlife. It has to be human science people, anthropologists, environmental scientists, water hydrologists. A lot of disciplines involved in One Health, which we are not able to figure out exactly who, but that's something we should think of. Like in India, I was recently working for entomological surveillance, and there are very few entomologists in India. Okay, and there are medical entomologists probably in 25, 30, handful of entomologists in India. And then we start talking about veterinary entomologists, probably another 5 or 6. I can name them on my fingers. So there is serious lack of people who are in that discipline. So we need to tell our students who are in sciences that, okay, there is something called as entomology. You should think about it. you should be aware about it. And if if you like, let's why don't you study about it? No, we have to really advocate the whole One Health at a very younger level, not just veterinary students or medical students or environmental scientists, probably at school level and college level as well. you know so that's one thing I think can have we can have a developed generation who will be having an idea of what One Health would be after next 10 to 15 years. That's what I think.
And to add to that, I think Dr. Mona, what you just said, I think it's really interesting. You called it baby steps. I think like incremental approaches are absolutely necessary here, because if every one of us thinks of like a perfect One Health project, like think of who would be involved. Like those are huge undertakings in the end, right? So often this is also what we recognized during our time being a PhD student in the graduate school, is that you have to boil it down. And in the end, you work under the One Health umbrella, but your topic itself might not be perfectly One Health. In my example, for example, I definitely was at the intersection of humans and environment. Like animals did not play a role in my PhD, aside from, of course, acknowledging that they have a super important role in AMR and One Health. And one thing, and this is also what I would like to echo or add from Anna's perspective, is to a certain extent also funding schemes, because what Anya just mentioned is exactly what we also encountered. It's like, please do a interdisciplinary and intersectoral or project, but please apply for a funding scheme in public health. It's like, yeah, no, this is not going to work in the end, because you will be actually thrown out because it's like, it's not public health enough, or like not specific enough to geography, or not specific enough to whatever. So I think we definitely need more targeted funding schemes, like really directed towards like inter and transdisciplinary research in the way, let alone like maybe journals that way can publish those results. As I mean, as scientists, we are probably in the end really interested in doing that, and we also received some feedback on some of the publications saying, like, yeah, no, this doesn't suit our journal because it's not specific enough for this discipline. And you're like, yeah, it is not, because it is supposed to be interdisciplinary. And I think there are also see, at least without being able to really give constructive feedback and saying, hey, this is what we need to do, but at least like on a general level, I think we need to change, or like at least expand our funding schemes to also include inter and transdisciplinary research as well.
I totally agree. I mean, even I was recently looking into all the fundings which are going in One Health. Okay, there is absolutely, I mean, if you compare the funding in chronic diseases, let's say diabetes, and if you try to compare the funding in One Health, there will be a serious disconnect. Okay, we do say that One Health is taking traction post-COVID, but where is the funding? I mean, I haven't seen the funding calls as well. And, and they are whatever funding calls are, they are lacking the One Health approach. That's even what I have observed. The last call which I was looking into was a Wellcome Trust call. They had, it was a very interesting call, which I was really intrigued about. It was on developing, climate sensitive tools for infectious disease surveillance. So that was one call. So I went on and, digged a bit more in Wellcome Trust funding. So there are very few calls, okay, and very few calls where an independent researcher could apply as well. Let's say as an independent researcher, I do have some ideas and I do have some projects, but I still cannot apply for these things because these funding calls, they are supporting they are supporting big industries and big companies and big institutes and large scale institutes, but they're not supporting individual people, let's say startups or anybody who is innovative. So I think we should create a platform on that as well. As One Health, young One Health, the professionals, we do have an idea, but let's say Denise, if you, me, or anyone just on an independent basis, we want to start a project, we would face many hurdles in that. So that's one point I think we should highlight. More, encouragement, more funding for startups as well. Let's say I want to start up a project on One Health, but I cannot do it for now because of lack of funding.
Funding, yes. The
Dr. Avi, sorry, you will not get the straightforward of a dream world of One Health. I think that you have very like young professionals, and we are always seeing what can be done, what can we change, how the rice that is not properly cooked is. I think
looking for some optimism, but I'm also glad to see some realism already baked in here a little bit. But I think incremental. Let's look at incremental wins. That I think is the key lesson that comes out of here. I'm happy that Dr. Mona was talking about, that this is going to take time, that fundamentally scientists or other folks do not necessarily know how to work with each other. So those boundaries will take some time, those disciplinary boundaries will take some time to break down so that people can learn to work with each other. Maybe it will take 10 years.
And these boundaries are inherently boundaries, they are just brought, we are brought up like that. It's not
Yeah.
purposely, there are some genuine boundaries, and I'm amazed about such boundaries because, it's just the way things are in India and the way you're brought up, there are some, they're not genetic, it's just environmental factors which you're brought up in, and that has influenced even decision makers as well. So it will take time, I guess. Like, it will take time.
Okay, so I think we're running out of time. Let me just have maybe a last question here, and then I'll look at some audience questions as well. So Dr. Percy, one of the challenges that we are facing, and probably developing countries are going to face this a lot more, although nobody's going to escape it, is from climate change. I mean, we've touched upon climate change a little bit. Do you think that the challenges posed by climate change make the risk of the next pandemic basically it makes it inevitable that given what's happening, we are going to have another pandemic, and climate change is going to make everything much worse. Sorry for being so optimistic about this.
Absolutely. I think that the risk of reoccurrence of the next pandemic is just out there. And this can be explained by the fact that, forests are destroyed, there is encroachment of wildlife area, there is, more extreme event like flooding and heat wave. There is also urbanization that is also happening. So all of this will contribute to the emerging and reemergence of new pandemic. And more specifically in African context, what makes it more difficult is not only the preparedness in terms of a health system, but also the difficulty to cope with the pandemic in economic terms, right? Because one thing is to talk about, we are kind of prepared for the pandemic, like the case of Ebola, where there is like some of the structure that are out there surveilling, but at the same time, we also have a really good, it's a high challenge in terms of how to cope with financially. And I don't know how this whole thing of, for sure, the next pandemic will come, but how are we going to cope? This is another question I can answer.
Okay, scare me. Tell me what the next 2-3 pathogens or groups of pathogens are that might be the candidates which can.
Well, we can talk about bats, for instance. They carry more pathogen than before, and because there is this group of, the bats are the group of mammal that are like everywhere, and because of the area have been, they are getting closer and closer to human being. The risk is already there. But we also have birds that can be and the same thing. It's just a problem of encroachment of space. Urbanization is not allowing wildlife to stay in the environment. So, sorry to scare you.
I have a question.
Yes.
On this group. Like, I've seen that the trend is like
and I was telling the histories, it matters a lot. And because I was talking on the group of these animals or pathogens, so we have seen that since after the century, before the centuries, and since after the centuries also, rodents were so prevalent to spreading the infection. Okay, and right now we are saying the bats are the one who are spreading the infection more, like they're the emerging reservoir and the carrier for the zoonosis. And a little bit right now in India is going the movement for the chickens and horses also. So what do you think? This is a setting a trend, like, okay, for this group, now second group, and now this third group is coming up. Apart from vectors, okay, apart from vectors.
As a veterinarian, my heart is sinking. I mean, what she's talking is completely right. Right now, bats are trending. Everyone is trying to incriminate bats, and it's really sad. I mean, what are you going to do about it? I mean, let's say we have pathogens in them, and when they are stressed, they want to shed more organisms. But I know for a fact in India, like, especially in the rural part, forget rural part, even state of Kerala, almost every house is surrounded by trees and bats and fruit trees and fruit bats. And my recent visit over there, I was just counting the bats around the trees. I was so obsessed about it. And I thought about it. I mean, there's nothing you can do. I mean, what are the interventions you can do? Let's say if you have a bad colony in your area, now you start thinking about those things. Okay, if we want to start working on One Health to prevent the next pandemic, let's focus on the interventions which are doable, sustainable. So neither are my animals affected, neither are my humans affected, neither is my environment affected. So we should start thinking about the interventions now. I mean, enough studies done on pathogen identification and finding sentinel organisms. Now let's move on, and see what can be done. Like even influenza, for example. Like I was just noting the statistics last year. 1.2 crores birds were culled in India. Okay, that's just official statistics of number of birds officially culled because of even influenza H5N1. And imagine the sheer number of birds which are being culled every year, which are undocumented. And just imagine the sheer number and quantity of funds which are being allocated for poultry farmers and as compensation to these owners. So we need to find a sustainable way. Sustainable policies is very important. At one side, the government is agreeing, is trying to improve the nutrition status of the population, and so wants to give more animals to the people. And the second hand, it is increasing the density of population among the animals in those same people. So these policies are not matching. So we need to start thinking on that aspect as well to prevent the next pandemic. It is going to happen. It is a matter of time. It's just when.
Yeah, it's on that note.
Can I add just
Yes, go ahead.
just one sentence?
Go ahead.
Because and I know in a short amount of time, but I would say it's super important, of course, to look into emerging infectious diseases, obviously. But like we should not forget that we have also antibiotic resistance or antimicrobial resistance already there, which we can actually measure to a certain extent. That is also coming. But I know we don't have time for that to discuss that now, but I just wanted to flag that maybe for the protocol or something. That we don't forget that there is actually kind of a threat already around the corner waiting for us that we know of, basically.
It's the next pandemic. It's actually a pandemic which is already ongoing pandemic, AMR. I agree with them completely.
Silent pandemic, yeah.
So I'll give you a result from a study in India that we've just submitted. Basically, there's a gap in, so there's lots of small scale poultry farmers that have set up poultry farms due to drought. So again, this is a link between climate change, agricultural practices, and food production. And because these are small scale farmers and they're being supplied all the materials by the big agri companies, there's no mechanism for disposal of carcasses or of the waste that's generated from the poultry farms. So although the farms themselves are kept quite hygienic, the carcasses are disposed of in an unscientific manner. Basically, they're thrown on the roadside, and the waste that's generated is then used as fertilizer for the fields. And what we found is there's high levels of AMR now being dispersed into the environment, into the food system, and into the groundwater. So there's a gap in policy that did not address that, and that's sort of raising alarm bells everywhere. I think it's easily fixable. We've got 5 more minutes, and I'm going to, most of the questions that I see here in the box have already kind of been answered. About pandemic preparedness and so on, and key interventions to sort of implement. So if there are no other questions from the audience,
Dr. Abhi, we have hand raised from Dr. Apurva.
Maybe, yes, please go ahead.
Yeah, hello, am I audible?
Yes.
Yes,
please
you
go
are.
ahead.
Yeah, it's wonderful conversation, and I just wanted to know from you and our panelists that what about mental health and how we connect mental health with One Health approach.
It's very connected. I mean,
I think that will take another 1 hour discussion.
Yeah. It is
But maybe go ahead and just, all the panelists, your concluding remarks on that, and then we close the session.
we all, I mean, I think we need to continuous mental health education and counseling for all the frontline workers and all the workers, all the scientists who have been working in COVID. I mean, if I just put one single statement, One Health will be only achieved if we are of sound mental health and sound mind.
Yeah.
Okay. And so mental health cannot be removed. It has to be part of it. That's what I'm saying. Everything is connected, right? So mental health definitely fits in the One Health background.
Yeah. So yeah, absolutely. So I just wanted to understand that mental health is also one of the vertical.
You lost Dr.
Yeah.
But any other comments from the other panelists on this? A last set of comments.
I think we do not have it here.
I'll give everyone one last closing comment from you. What's your last message to this audience, and we'll then close there. We'll start with you, Anna.
Yes, I was about to say something about mental health, but even expand it. I think that is something we did in the first batch of the graduate school, that we recognize that it was not only the physical domain, but also mental, the social health, how that looks more at inequalities and the way societies engage, but also there are a lot of groups in the population in different countries in which the spiritual domain is something that it's not part of the mental life. It stands alone and has value on its own. So I think that there are different domains of health that we typically don't take into account that should definitely be considered. And I think that is on itself a learning for the new pandemic. There are also on share on your previous question, like where is the next pandemic coming? I think that the next pandemic we will search for it. The pathogens are not messing with us as long as we don't mess with them. But we go deep into the forest, search for it. We go to find wildlife. We also have like these monocultures and very intensive farming. I think that is something that we will. It's not that it's coming to us, but we are going straight to the next pandemic ourselves as humans if we don't learn that we have to live in a sustainable way. And I think that will be my last comment for today. Thank you.
Thank you, Dr. Kwasi.
We have observed during the whole panel that One Health needs more trained experts, and One Health needs more funding scheme. So that will be my take home. And maybe out there are some people hearing us. So we need more experts in One Health. Thank you.
Dennis?
My last take would be that we definitely need to improve and scale up surveillance activities under the One Health umbrella, specifically also looking into potentials for environmental surveillance, as I think this is can be definitely a way forward. Thank you. And thank you for organizing the event and thanks for having me.
And Dr. Manal, your last comment?
I agree with both of them. And so improving surveillance, okay, animal, human, environment, informal, formal surveillance, and pushing for more funding for One Health. And third, getting One Health in mainstream. You know, it should be in mainstream media as well. I mean, we need serious advocates of One Health now.
I think that's a good remark to close on. And I thank you all for being on this panel. It's been excellent discussion. I've learned quite a lot from your perspectives as well. And I hope that the audience who's been listening in have learned too. And I hope we can keep in touch in the future and continue this conversation on another panel, another debate, or maybe perhaps meet in person as well in the future. I look forward to that. Thank you also to the organizers for having me as chair of this panel. I will hand it back to you now, Dr.
Okay, so I think we really had a very vibrant and very good discussion. We still have so many points, but I think we do not have time much. So maybe next time. It was really vibrant and very useful discussion which brings up many new points to think of. For example, funding, experts. India needs a very much capacity building because if we want to fund it, we need a capacity building. So apart from that, also Koti highlighted the data modeling validation is also very much important for the future pandemics. And Dr. Apurva highlighted the future of the One Health, mental health, which can be expanded. And antimicrobial resistance, of course, I think it is going to be a next when COVID-19 is going to be a little bit down and the EMR will be in highlights of in everyone's point of view. So I thank you all the panelists, Danny, for Coffee, Dr. Monal, Anna, for accepting our invitation. And I'm so grateful to Dr. Avi for accepting the chair invitation, because I was really looking forward in the Indian perspective, somebody who can interconnect all these aspects. And I think you justified the job very well. And I am also thankful to our director, Dr. Apurva Kumar Pandya, and our medical director, Dr. Gitika Madan, and Pariv University for allowing us to organizing this panel discussion. And of course, last but not least, we have collaborated with World Federation of Public Health Association. So we are also grateful to them for providing, for involving us in their four-day global public health week celebration. I hope we will be in touch in future. And of course, when Anna is going to visit in September, I guess, to India, we will try to organize an offline One Health Symposium here at Pariv Institute of Public Health. So looking forward to see you all in future physically. With this, I would like to end this panel discussion. And yeah, last but not least, thank you so much all the participants and attendees for listening us patiently.
Thank you, Rupali. Thank you, everyone. And thank you for calling us. It was a wonderful opportunity to meet with like-minded people, you know. So very glad to see that.
Yeah. Thank you, everyone. And hopefully we can have a consortium of experts and we can take a learning forward from this event. So we don't want to keep this as just a discussion, but how can we convert into advocacy and develop some collaborative research projects centered around One Health perspective. So thank you all panelists and speakers and chairperson and all participants. Thank you.
Thank you. See you.
Bye.
Bye.
Thank you, everyone. Stay
Bye.
healthy and take care.
And
Bye.
bye, Dr. B. Bye, Dr. Kosi. And wait, hold on. She left. Anna. Oh no, Anna. Yeah, hi, Anna. Bye, Anna.
Bye bye.
Bye. Have a good day.
Bye.